Hey guys, what's going on? I wanted to make this video about a personal experience because I don't really see too many of these on YouTube about scoliosis surgery. It's a very major, important, life-altering surgery that a lot of people get. I've known some people personally, and I got mine on March 13th. I had very severe scoliosis, and what that is, people watching this video don't know. It's the curvature of your spine, and basically you could have two forms. You could have the hunchback kind, where your spine is going forward like this, which I don't think is as common. I don't really know scientifically, statistically. But anyway, but mine and most of the people who I have known who have had it, it goes to the side. And I had two curves, one in my upper, which is thoracic, and in the lower, which is the lumbar area. And if you looked at my spine, it was almost an S shape, and it was progressively getting worse. In March, when I got the surgery, my upper curve was 68 and my lower was, I believe, 58, and it just looked horrible. It was pushing my ribs out. It was it was bad. I never had any real pain. Sometimes I would get it where my shoulder would fall asleep when I had my book bag on my back at school, and so that wasn't very pleasant at all. But I got to tell you that the results of the surgery are amazing, and never been that tall, but it really affects your height having this condition, and it knocked me down to 5'3". And after the surgery, I'm exactly 5'5". I'm not that tall, but it goes a long way, adding 2 inches to your overall height. And I was very pleased with that. And basically what the surgery is 2 titanium rods inserted into your back. It's a major surgery. It's a major recovery. You're not going to be very comfortable at first. You probably need to be on medication from the surgery. You're going to have to be in the hospital at least 5 days. That's how long I spent post-op in the hospital. It's not pleasant. You really don't have an appetite after getting out of surgery, but you get it back in due time. And the thing is, why it's so important to get this surgery, because if you have it the way I do, not only does it start pushing your ribs out, but it'll start leaning on your lung and can soon lead to oxygen deprivation. You won't be able to breathe. It can, in other words, it could start crushing your lung, to put it in layman's terms. So yeah, it's very vital. If you have scoliosis and your doctor says that you need the surgery, I suggest that you don't delay on it. I'm standing before you, and like right now, I'm in about 2 weeks or so, I'm about to, give or take a couple of days, I'm about to hit 3 months post-op, and I'm starting to really feel like $1,000,000 again. So yeah, so if you guys got any comments, subscribe. I'll even make additional videos if there's anything that you want to know specifically about it. Alright, I will see you in the comments. Have a good day.